The health department is recommending against the use of cloth masks outdoors. The DOH explains that surgical masks are still preferred since these provide better protection against COVID-19 and its variants. To tell us more about all of this, we have Greg Gregorio now joining us live from Mandaluyong. Greg, good afternoon. Could you talk us through why the DOH has suddenly recommended against the use of cloth masks?
Yes, Charles, according to Health Undersecretary Maria Rosario Vergere, this recommendation is pursuant to the interim guidelines of the World Health Organization, saying that if an area is having a high-risk classification due to the increasing number of COVID-19 cases and transmission of the more transmissible variants of the SARS-CoV-2, the use of medical-grade masks or surgical masks are recommended instead of the use of cloth masks. As you have said, health authorities are saying that the surgical mask gives better protection against infection of COVID-19, but the Department of Health clarifies that if without access to surgical mask, cloth mask may still be used instead of having no masks at all. Charles?
Greg, I understand that there are new A2+1 and A3+1 vaccination strategies that are being implemented by the government. Could you tell us more about this?
Yes, Charles, this A2+1 and A3+1 strategy is the government's move to encourage more individuals to be vaccinated. For the A2+1, those senior citizens who would come to vaccination sites and receive their jabs may bring an additional individual from their household, be it their caregiver or any part of their family, to receive their jabs. According to Health Undersecretary Maria Rosario Vergere, there are studies saying that once a senior citizen or an elderly see or witnesses a successful vaccination to their family member or from someone they know, they are immediately encouraged to have their vaccine too. And now for the A3+1, the Department of Health clarifies that this does not cover all individuals under the A3 sector or the persons with comorbidity. Vergere emphasized that this would only include those A3 who are having having cancer or had a transplant, or those who are immunocompromised. According to Vergere, the policy is still being routed for signature as of the moment, and they expect for the release of this policy within the week. Charles?
Okay, Greg, let's talk about quarantine for COVID-19 patients for a bit. Is the government allowing home quarantine in case you develop COVID-19 symptoms? And what are some of the limitations on this measure?
Yes, Charles, according to Vergere, this recommendation is to pursuant to their earlier recommendation allowing home quarantine for asymptomatic, mild, and moderate COVID-19 cases. But if they're only allowed by the local government units to do home quarantine, if they will ask for home quarantine, requirements would be they have their own rooms, their own comfort rooms, they have access to medical supply, they have access to healthcare workers who would monitor them. And Vergere said if local government units would say that an individual or a COVID-19 case with asymptomatic, mild, or moderate infection is guided to be at a specific quarantine facility, they should follow these measures by the local government, as it is also provided under the law for us to follow these measures under this pandemic.